Hi, and welcome to the fifth episode of the podcast series Healthy Dose. I'm Shreya Shrivastava, your host for this episode. Today, we will be speaking to Dr. Aqsa Shaikh, an associate professor at Hamdard Institute of Medical Science and Research. Dr. Aqsa heads the COVID 19 Vaccination Center at the Institute. In the first four episodes of Healthy Dose, we have discussed various aspects of vaccination. We have discussed the regulation of clinical trials, the economics of global vaccination, the ethics of vaccination, and how technology is used in the distribution of vaccines. But as vaccines reach from labs to the people, their most direct point of contact is the COVID 19 Vaccination Center. What happens at the vaccination center? How do vaccination centers receive and store vaccines? How do these centers register their beneficiaries? How do they respond in case of adverse events? How can the experience of vaccination centers become more inclusive? We asked these questions and many more to Dr. Aqsa, who is also the only transgender person leading a COVID 19 vaccination center in India. Dr. Aqsa speaks about her day-to-day experience of heading a vaccination center and how her own history of COVID-19 helped her become a more empathetic administrator and doctor. I can't wait to share this very special interview with you. So let us dive right in. Welcome to our podcast, Dr. Aqsa. So glad to have you with us.
Thank you so much, Shreya. And it's really a pleasure to be talking on an issue which is so close to my heart, as well as, a very burning topic in the current scenario.
Instead of diving right into the world of vaccines, let's talk a little bit about your journey as a medical doctor and how the COVID 19 pandemic has impacted it.
I did my MBBS and MD from Mumbai, from KM Hospital and Sage GS Medical College. And I'm very happy to know that my former dean was a speaker in the previous podcast. And post that, I have been working in the nonprofit sector for a few years before switching on to the academics in the medical college. And I'm also involved right now in the implementation in terms of the COVID vaccination program, as well as in the COVID vaccine trials. The medical journey has been challenging, but it's really, exciting to be in 2021, a year in which we have been able to launch vaccines in the shortest possible time ever in the history of the mankind. And a tool which is, a boon to the mankind in the sense that it's one of the strongest tool for protection against infectious diseases that we have with us. As far as, dealing with the COVID times is concerned, 2020 has been a challenge for all of us. So it was for me too. And unfortunately, in September 2020, I too suffered from COVID infection and had to be hospitalized for 10 days for it. And those 10 days, were spent in a lot of introspection, in developing empathy for other COVID patients. And once I was discharged from that, I really engaged myself into research work and into the surveillance and vaccination programs. And this has brought me here today, being the nodal officer of a COVID vaccination center. And if I may add also, the first and the only transgender person to head a COVID vaccination center.
As I was just going through your social media and your tweet when you had tweeted about, that if you could claim to be the first transgender person to head a vaccination center and the only one, your inbox was flooded with multiple congratulatory messages. But as you said, it also shows the reality that out of 130 crores people in India, you are the only one doing that. I wanted to know that how your experience has been heading this vaccination center. This is like a public facing opportunity. So how you're using this opportunity to create awareness and sensitization?
As you correctly mentioned, it has been really a blessing to be heading a COVID vaccination center, especially as someone who has had the experience of being a COVID patient myself, and also as someone who comes from a marginalized group. And I have really taken this opportunity and embraced it and tried to, use my experience of minority stress and making sure that I create an open and a safe space for not just the gender and the sexual minorities, but for everyone, who is suffering either because of the issues of ability or other vulnerabilities. It's really a very challenging position, especially since the rollout of the vaccine has been done at breakneck speed in India. We started vaccination program on 16th of January, and we were one of the first centers in Delhi to start vaccinating. The SOPs and the protocols, they all developed overnight. We were all learning, as we were doing things. So it has been a very challenging thing, especially since it's a public-private partnership. We are a private vaccination center, and the program is basically managed by the government. So it was a great learning experience in that sense, and also the challenges which came up every day, and solving those challenges that really gave us a high at the end of the day. And as the program is evolving, it's now more than 2 months, and every now and then, the categorization changes, the eligibility criteria changes. We keep on getting new information about the vaccines. There are new adverse events which keep coming to the notice. There are new mutant strains coming, and there are questions if the vaccine is effective against them or not. So it's a job in which you can't really get complacent. You have to be on your toes, and you have to keep learning, and you have to keep answering. And one of the important jobs that I have to do here, is to allay the anxieties and the fears of the people who want to get vaccinated.
In the supply chain of vaccines, the vaccination centers being the final point of delivery, how the logistics of this works. If you could please tell our listeners a little bit about how, in terms of supply, storage, and distribution of vaccines at the vaccination centers, how it works logistically.
You've asked a very pertinent question, and I think it's also important for the common people to understand the amount of effort which goes into developing and transporting the vaccines before it's made available to the beneficiaries. So, as I mentioned, this is the fastest ever in the history of mankind that we have developed a vaccine from the scratch. And all of these vaccines go through animal studies, and then they go through human clinical trials. We have phase one, phase two, and phase three trials. Most of the people have heard these terms now. And only when the vaccines clear these trials, then they are approved, and then they're produced for the mass level and supplied to the people. Now, when it comes to the vaccines, for example, we have Covaxin and Covishield vaccines in India. These are manufactured in places like Pune and Hyderabad. And then these are transferred through cold chain systems, which involve aircrafts, cargo systems, which are completely, in the temperature range of sometimes even less than 0 degrees Celsius. And they have to be kept in the 2 to 8 degrees Celsius temperature all throughout. These come to the state hubs. So, for example, giving the example of Delhi, all the doses which come to the Delhi, they come to a central point or the state hub. And from there, these are then transferred to the various district offices through, again, refrigerated vehicles. And this is all done, with strict security protocols. They are escorted by the police because each of these vials is very expensive, not just in terms of money, but also in terms of the number of lives that it can save. And there's also concern about replacement of the vaccine vials with the duplicate vaccines or something of that sort. So it's done with a very high level of security. Most of the districts, for example, now in the Southeast district, there's a new system which has been developed of cold chain completely. So though we did have the old cold chain system in place, for COVID, an entirely new cold chain system was established at the district headquarters in the district magistrate's office, for example. And from there, these vaccines are supplied to, almost 50 to 60 vaccination centers, which may be present in that district. Some of the districts are more than 100 vaccination centers. And all this happens completely in cold chain under police escort with a lot of security. Some hospitals do have their own cold chain points. Some of them do not have the cold chain points. So from the district, it comes to the hospital cold chain points. And from the hospital cold chain points, every day the vaccines are taken to the vaccination center. The used vials are discarded and the unused vials are brought back to the vaccination center. So it's a huge cold chain management system which is in place for ensuring that you get the right vaccine and at the safe and the potent vaccine also.
This is a really new information. we've been hearing that we are using the existing infrastructure under the universal immunization program for COVID-19 vaccine distribution as well. But it's really good to know that like we have also developed new cold chain systems, particularly for the distribution of this vaccine. This brings me to my next question, Dr. Aqsa, that how has the response of public been at the center? Like, given that you are the final contact point between this public health delivery system and the public itself, what has your experience been interacting with the public and, as you mentioned earlier, resolving their anxieties about vaccination?
When it comes to the vaccine beneficiaries, as you know that in the first phase, we started with the vaccination of the healthcare workers. And later on, we moved to the vaccination of the frontline workers. And finally, on the 1st of March, we started vaccinating those who are elderly or those who are in the middle ages with comorbidities and so on. Now, initially, when the vaccines were launched, these were launched in emergency use authorization. And one of the vaccines, Covaxin, was in the clinical trial mode, which means the informed consent was taken from every participant who wanted to take the vaccine. Now, since a lot of safety and efficacy data was not completely available in public domain and it was not published in peer-reviewed journals, there were hesitations amongst the healthcare workers who have a little scientific knowledge about vaccines and their efficacy and safety trials. So in the initial phase, at least, we saw that a lot of people were very hesitant to take vaccines, or they wanted to take, for example, Covishield vaccine, which had some phase 3 trial results that compared to Covaxin, which was conducting the phase 3 trials simultaneously. So we also saw a lot of vaccine hesitancy, even for the Covishield vaccine, which had the evidence because it's a new product. And in January, when the vaccines were launched, we were having relatively low numbers for COVID cases. So complacency had developed in the people. They thought, oh, the pandemic is waning and we do not need the vaccines now. Some of the healthcare workers, almost 30-40% of our healthcare workers, have been already exposed to COVID and have antibodies against it. And therefore, they had more reason, to delay the vaccination or not to take vaccination. However, we have been trying to talk to the healthcare workers, trying to allay their anxieties and providing the immunological basis for taking the vaccination, even if they have had COVID infection or even if they have been exposed to the COVID patients. Slowly and steadily, we have seen that the healthcare workers have started taking vaccinations, but we had to deal with a lot of rumors and misinformation, outbreaks which happened. For example, a lot of nurses in our place did not take the vaccine because there was a rumor that this vaccine causes infertility in women of reproductive age group. And therefore, you had a huge cohort of nurses, which was left unvaccinated because they had these unfounded fears present. Similarly, the vaccine is not indicated in women who are breastfeeding or who are pregnant. And therefore, a substantial number of our nurses again were left out of vaccination. Later on, when the frontline workers were included, again, the same problem persisted. Now, many of the frontline workers do not have the same level of scientific temperament or literacy as in the case of the healthcare workers. So it took even more effort, to make them understand the immunological basis or the safety of the vaccines. And now we finally have the elderly. Fortunately, we sometimes see that a lot of elderly are very enthusiastic and gung-ho, about taking the vaccines. Because for them, it's finally that they'll be able to step out of their houses or will be able to meet their grandparents freely once they have taken the 2 shots of the vaccine. So there's a lot of optimism in the elderly people, at least I must say, about the vaccination when it comes. And fortunately, we are also seeing that the elderly do not have much AFI or much of the adverse events that we used to see in the young people. So that has also added to the public confidence in the vaccines.
I'm glad that you also mentioned, Dr. Aqsa, about adverse events. And I was also wondering that, like, how you deal with adverse events, if there are any instantly or even later on, then how do you follow up with that from the vaccination center?
Fortunately, we do have a lot of experience in dealing with the adverse events following immunization in our national immunization schedule or the childhood immunization program that we have been running, which has injectable vaccines also, and also with the pregnant females immunization program. So there is an EFI system which was already in place, and we just had to strengthen it and redesign it to deal with the COVID vaccination. So, when it comes to the adverse events following immunization, all the vaccine beneficiaries post injection are observed for 30 minutes in the observation room, which are inbuilt into the vaccination centers. And all these observation rooms do have the AFI or the anaphylaxis kit, which has adrenaline, which is the drug of the choice for dealing with the anaphylactic reactions. And all the nurses have been trained into administering this shot. In addition, all of these AEFI related cases can be also referred to the AEFI link facility, which is generally a hospital of tertiary level, which is equipped to manage with such cases. There's a CATS ambulance or a private ambulance, which is generally stationed at all the vaccination centers so that within a few minutes, the person can be transferred to the link facility. So all these places have been put in place, but we do know that AFI can happen anytime, and therefore it's very important that the staff on site is trained, and that's a continuous process of training and retraining the staff for giving the vaccination. When it comes to the reporting of the adverse events following immunization, this is inbuilt in the COVID app for the reporting of the AFI. So all those AFI which happen within 30 minutes, which are in on-site AFI, these are reported directly over there. And even those which happen post 30 minutes are reported to the ANM, because the SMS which the beneficiaries get, that has the number of the nurse who had vaccinated the person. So they can report the adverse event to that nurse, and she can ensure that it is entered into the COVID portal. All the AFIs are monitored by the district immunization officer and later on by the state immunization officer. And in case of any death or any severe adverse reaction, this is dealt with by the committee which is made for the same purpose.
Dr. Aqsa, you also mentioned, given we have only two vaccines right now, Covishield and Covaxin, and particularly people were reluctant to take Covaxin because it was in the clinical trial mode and we did not have enough data about its efficacy. We discussed this earlier also in our first episode with Dr. Sagar and Dr. Dhwani Mehta. Now the efficacy results, like at least the initial efficacy results from Covaxin trials are out, and also the nature of approval has been changed from clinical trial mode to the restricted emergency use. So how has it changed the protocol regarding the delivery of Covaxin?
So previously, when Covaxin was in the clinical trial mode, every vaccinated person had to be administered an informed consent. And then they were also monitored for a long-term period for the development of the adverse events following immunization or any other effects. However, now since it is only in the emergency use authorization, similar to the Covishield vaccine, there is no need of taking the informed consent, and also the monitoring post-vaccination is also the usual 30 minutes or later on the usual monitoring and not in the clinical trial mode. This has really made the vaccine delivery and the implementation of the program much easier at the field level, because then you need lesser number of staff and also you can vaccinate faster, because the general 15 to 20 minutes which is required for the administration of the informed consent is not needed now. Also, the acceptance of the vaccine has improved a lot post the approval of the vaccination. So we see a lot of people now, opting for Covaxin in place of the Covishield vaccine, which unfortunately had a doubt raised on it regarding the blood clots recently, and it is still fighting that controversy. Also, the efficacy of Covaxin has been found to be slightly better than Covishield, and people have a tendency to compare the numbers of these vaccine efficacies, and therefore some people are preferring Covaxin over Covishield. But I would suggest that people should take whatever vaccine is available to them without much delay. We need to develop herd immunity as soon as possible, and for that, please just go ahead and take whatever vaccine is available to you, and if you're eligible.
We have been seeing from your social media also that you have been appealing to take vaccines, and like given now the rising number of COVID-19 cases, I think this is the time we really need to get serious about it. We also spoke to Dr. Sharma, and Dr. Sharma earlier pointed out that there are many challenges that we are facing currently in the rollout of these vaccines, given this is the world's largest rollout of COVID-19 vaccine. And some of the challenges he mentioned were like the diversity of population and the reach of vaccines in remote and rural areas. Dr. Sharma also mentioned that technology has played a really important role in making vaccines reach people to the remote areas. So, wanted to know from you, Dr. Aqsa, that how technology and data management has helped in facing some of the on ground challenges at the vaccination center, particularly with respect to registration, dosages follow up, etc.
We had the experience of the Evin app, which was used for cold chain monitoring. And when the COVID vaccination program was launched, we developed what is known as the COVID application or platform for registering for the vaccination, for verification of the vaccine beneficiaries, for recording of the adverse events following immunization, and also for the other data management purpose. Now, since the app was developed on the go, as the program was launched, and new features were added to it every weekend, literally. So there were initially some problems in the rollout of the app as the new features were added. But what we found is that the app has really ensured that there is authentic delivery of the vaccine to the persons who are eligible for it. When it comes to vaccines, or any such large scale program, there are generally accusations of, people who are not eligible getting the vaccines or people who are eligible not getting the vaccines. So the app has really played a role in ensuring that there's no duplication and there's proper authentication of the persons for taking the vaccine. However, whenever such apps are developed, there are always issues of data privacy. There are issues about broadband. There are issues about internet connectivity, especially in the rural areas. So all these issues have been there. Fortunately, the lockdown period had ensured that most of the people had switched on to some kind of smartphones or devices. A lot of people had also subscribed to more internet connectivity. The Wi-Fi penetration is increasing. So all these background things have really helped in ensuring that the COVID platform can be used. Also, in the initial phases, all the vaccine centers were located in the hospitals in most of the urban areas. And that has also helped us, in gaining the experience about the vaccination program before it reached the rural areas and primary healthcare centers. But we do face the issues of technology, and also people generally have hesitation in using technology when it is linked to Aadhaar. So as you know that in the COVID platform, along with the registration for the vaccine and along with the verification, you also have an option of creating the universal health ID, and there is a separate consent for every beneficiary when that universal health ID is created. But how many people are really aware about it, and is that consent really taken from the people? So there have been issues of how this data is going to be used, since there are a lot of private players also involved in the development and the management of the COVID app. How this data is stored? Is it Amazon Web Services? So what are those? So there are a lot of these unanswered questions, because of which people may not have faith or may be reluctant in using Aadhaar as a mode of verification. But yes, the app has played a great role in ensuring the fast delivery and ensuring equitable distribution of vaccine.
Right. I'm glad, Dr. Aksa, you mentioned some of the issues related to privacy and data that people have been raising. So, what do you think we could do better to make this platform more inclusive, more accessible, and it can be more informed, particularly for people who are not aware about it entirely?
If I speak from the perspective of gender, the vaccine system does have the gender male, female, and the others included. Also, all the IDs which we are using for the verification do have some form of inclusion of the transgender persons also. There is also a host of IDs which can be used, which ensures that Aadhaar is not the only ID which is enforced for use. However, there is a general focus on using of the Aadhaar as a mode of verification, so that the universal health ID also can be created of the persons. When it comes to the inclusion of persons with disabilities, unfortunately, this is where we are lacking. Though there is an effort to ensure that these COVID vaccination centers are accessible to persons with physical disability or locomotor disability, what about the accessibility of these centers by persons with different forms of disability, like speech impairment or hearing impairment, persons with intellectual disability, and so on? So this is really a question, about complete inclusion of the persons with various kinds of disability. Also, most of the IC material, for example, which is used is either in Hindi or English or one of these state languages. But what about persons, let's say, with visual impairments? Do we have any poster in Braille, for example? Or how many of the audio messages or audio systems are in place, at the COVID vaccination center for the persons with disability? So without a SCOT or without a support system, it's really very difficult for persons with disability to access these vaccination centers. And it's left really to that vaccination center to increase the accessibility issues. So this is one of the points, which can be really included as we go along in our vaccination program to make it more inclusive.
This is a really important point that you raised, Dr. Aqsa, about accessibility and inclusivity of persons with disability in the whole vaccine ecosystem. And given how the number of cases are rising and the categories of people who are currently eligible for vaccines is limited, I wanted to understand from you that where we are at the production of vaccines currently and whether we have reached that stage where we can make it open for other categories as well.
So recently, the government has increased the age limit, and now people who are 45 years or above can get vaccinated even if they do not have any comorbidity present. And that's really a welcome change in view of the second wave. However, many of the states have demanded that it should be 18 years and above, since the middle age of the 18 to 45, which is left out in the current scheme, is the one which is actually going out and working and is the economically productive age group, and also now the age group which is affected a lot in even having mortality a lot, as we see in some of the states like Punjab. However, we do not expect really the government to decrease the age limit to 18 years at least in the month of April. And one of the issues for that, of course, is the supply of the vaccines. Currently, only two vaccines are approved for use, that is Covishield and Covaxin. Probably adding more vaccines to the basket would ensure that we have more options to order, and therefore the supply is not really an issue. Similarly, India is the world's largest manufacturer of vaccine, and we have been giving vaccines to the COVAX facility of World Health Organization. We have been also giving vaccines as part of the diplomatic relationship building, the Vaccine Maitri program, to a lot of countries in Africa, a lot of countries in Southeast Asia, and so on. And as a result of this, it also compromises on the domestic supply of the vaccines. So we need to really ensure that we are able to balance the two, the domestic supply as well as the international diplomatic supply of the vaccines or as part of the WHO COVAX facility, so that there is equitable access to the vaccine. India is a middle income country, and we know that a lot of people in terms of population, may have to wait for at least 2 years to get vaccinated if we go at the current pace of vaccination. And here we have lessons to learn from a lot of countries like, Israel or UK and USA, which have done quick vaccination of its large number of population. So yeah, I mean, when it comes to the supply, it's always a challenge, though we may say that, we have a lot of stock of the vaccines, but since the demand is increasing day by day and we want to do as quickly as possible, including more vaccines in the basket and also ensuring the domestic supply gets a priority over the international supply can help in dealing with this problem.
I think we can end on that a very hopeful note that we need to find a balance between, the domestic supply and also our international diplomatic relations. So, at the end, I wanted to know from you what your learnings have been from this entire experience of the pandemic and vaccine delivery, and how like we can learn lessons from the current pandemic to the future ones.
The journey of vaccine development has been, really, really very heartwarming in terms of how a disease which had, you know, um, literally wreaked havoc on the humanity, and millions of people have died. And now we had a hope in the form of the vaccine. But it is also, very disappointing to see that a lot of people who were waiting for that miracle, silver bullet of the vaccine are now hesitant to take the vaccine. And this includes some of our peers, doctors and nurses, who have also, lost their near and dear ones in the pandemic. So my important learning for this, is that when diseases come, we human beings also exceed their limits and come out with, I would only call it a miracle in terms of the vaccine. But then it's also upon us, to accept these things and to have faith in science, to have faith in the vaccines. Just to mention a recent incident where a chief minister of one of the states had said that faith will overcome the fear in the COVID, and then 2 days later, the same person came down with COVID. So this is the message, that I want to really give to the people, that have faith, but do not have blind faith. Have faith in science, have faith in the human efforts, have faith in the governments. Though I know it's difficult at the current point, but do have faith in the vaccine supply system. And as someone who is part of the vaccination program, I'll only say this, that a lot of effort has gone into it. So please make sure that you get vaccinated if you can. It's not only going to protect just you, but also your near and dear ones who are very precious. So just go ahead and get vaccinated is what I say to everyone.
Talking to Dr. Aqsa was incredibly enriching and heartwarming at the same time. Dr. Aqsa gave us a valuable insight into how a vaccination center is run and what does it take for the vaccine to reach you. But more importantly, the interview with Dr. Aqsa reinforced the necessary yet revolutionary nature of the practice of empathy in caregiving. We owe a lot to healthcare workers and caregivers like Dr. Aqsa who put themselves in risky situations for the greater good. This brings us to the end of this episode. Thank you for tuning in. So far in the series of Healthy Dose, we have talked about how the vaccine reaches from the labs to the people. But what happens after you have taken the vaccine? In the sixth and the final episode of the season 1 of Healthy Dose, we will speak about international geopolitics and how it is being shaped by whether or not you get a vaccine. We will be speaking about the legal, ethical, and geopolitical implications of vaccine passports with Madhvi Sengutwan. Madhvi is a doctoral candidate and a research associate at the Center for Biomedical Ethics, National University of Singapore. To hear more, tune in to the final episode of Healthy Dose next Tuesday. You can find us on SoundCloud and Spotify as Vidhi Center for Legal Policies podcast. You may also listen to us on Google Podcasts or iTunes. Don't forget to grab your Healthy Dose next Tuesday.